Coughing is the reflex action to clear the air passage followed by forceful expulsion of air. It helps in clearing the irritants, fluids, microbes, or any other substance that is foreign to the body. It can happen due to some irritation in throat, smoke, gas, if food is not swallowed properly, infection, etc. The prolong of coughing indicates the presence of some sort of disease or infection. The infectious pathogens which transmit through air such as bacteria or virus cause the host to cough repeatedly in order to get transmitted from one host to another. It may persist for days to months in severe cases. Symptoms may include pain in throat, chest congestion, pain in chest, fever, body pain, and the pain in nose as well. Dry cough. There are two types of coughing phenomenon. Productive. In this there is mucus blocking the lungs and hence the coughing results in mucus production in order to clear the lungs. Health experts consider this as productive as during this the removal of mucus clears the air passage and relieves lungs. Non-productive. In this there is no mucus blocking the lungs, therefore there is no mucus production. This is known as dry cough. As there is no mucus production, the coughing doesn't lead to clearing the lungs or air passage. Hence, it is considered as non-productive. Why does dry cough cause chest tightness and pain? Like every other infection or disease, it also has acute and chronic phase. Acute dry cough, the cough that lasts for less than or up to 3 weeks. Chronic dry cough, the cough that lasts for more than 3 weeks. During dry cough, there is just forceful expel of air from lungs as there is no mucus to expel. This vigorous and forceful coughing of air exerts unwanted pressure on muscles and tissues of lungs and air passage, cause minor rupture in some cases. Along with the pain in chest during coughing, people may also feel the persistent tightness in chest as there is some weight on your chest. Also, there should be the squeezing sensation and burning feeling in the chest. Causes of dry cough. There can be multiple causes of a dry cough which include asthma. It is a chronic condition in which the air passage or the windpipes gets inflamed, make it difficult for lungs to breathe. It can be productive as well as non-productive, but mostly it's non-productive. There is also a special category of asthma in which the dry cough is the main symptom known as cough variant asthma. The other symptoms may include wheezing attacks, heavy breathing, shortness of breath, pain and congestion in chest, swelling in chest. It can be treated by certain corticosteroids such as fluticasone, budesonide, etc. GERD, gastroesophageal reflux disease. In this, the acid from the stomach moves to your esophagus due to the dysfunctional sphincter. This can cause the damaged esophagus cells along with cells of pharynx and respiratory tract. The person may feel the burning sensation, chest pain and the cough refluxes. The other symptoms may include the vomiting of the food and drinks, hoarseness, chronic soreness in throat, hard to swallow food or even drink something. Post-nasal drip. It refers to the dripping cough beneath the throat. When the person is suffering from any infection or allergy causing cold, then there is more production of mucus than before by nose, which is too watery and drips easily. The symptoms may include sore throat, itching and tickling in throat, stuck lump, difficulty in swallowing. Pathogenic infection. During an infection by any bacteria or virus, there is coughing with mucus in it that lasts up to 2 weeks. During this time, the sore throat and swelling is common complaint. Due to this, after the infection, the throat still feel itching and soreness causing dry cough. To treat this, patience is required and the reoccurrence of any infection should also be taken care of. Allergies. Allergies generates when your immune response mistakes a harmless foreign substance for harm to the body. The body generates immune response against that foreign particle such as coughing, sneezing, fever. These symptoms occur more when the allergy is related to respiratory system and the entering foreign body's passage is also respiratory system. Other symptoms may include watery red eyes, running nose, itchy throat, etc. COVID-19. In this, the infected people develop early symptoms as dry cough as well as mucus cough. Other symptoms may include fever, body ache, heavy breathing, chest tightness, and even death in severe cases and in people with older age. Environmental factors. Factors such as smoke, fog, dust, mold, sulfur dioxide, nitric oxide, are some common irritants that can either stuck in our airways or can cause an immune response against themselves, causing dry cough, heavy breathing, sore throat, red eyes, etc. Some people have sensitive system, therefore caught cough if the wind is too dry or cold. ACE inhibitors, these are prescribed to people suffering from high blood pressure. Few examples include enalapril, lisinopril. Patients who are suffering from high blood pressure after complain about prolonged cough due to the ingestion of these medicines, as they make the throat dry and create the urge of thirst. Pertussis, it is the condition of uncontrolled cough with a whooping sound due to bacterial infection. It is also known as a 100-day cough. In the early days it is often confused with the common cold, but later it gets worse as the soreness in throat increases and often create bruises in the inner muscles and tissues to the air passage. Usually occur in children or young people with compromised immunity. It, however, can be prevented by vaccination. Lungs cancer cough can be a sign of a lung cancer which persists for a long time. It only gets worse with time and may produce different heavy sound than earlier. If the person smokes for over a long period and have cough, then it may be a sign of lung cancer. Other symptoms may include coughing blood, soreness in throat, unexplained weight loss, hoarseness, heavy breathing, pain in lungs especially during heavy breathing and coughing. Collapsed lungs, the deflated lungs cause pneumothorax, due to sudden pressure applied on the chest region or due to some injury. It is common in people with some ongoing lung disease or childs with poor development of lungs. Due to this, one may also feel shortness of breath and severe pain in chest. Idiopathic pulmonary fibrosis, it is characterized by the scars and damaged tissues of your lungs, making the breathing process difficult. Along with heavy breathing, chronic dry cough, pain in lungs, weakness and random loss in weight are other common symptoms. Vocal cord dysfunctional. The congested vocal cord doesn't leave plenty of passage of air to pass away, leading to forceful breathing and hence coughing. It is often mistaken as asthma, but in this there is a band occurs in the vocal cords, so when you breathe, they will move accordingly, but the occurred band in then will cause a hindrance for air to pass. Feeling of choking, suffocating, tightness in throat, difficulty in swallowing, high-pitched whooping are the other symptoms.